Hi students, I am Dr. Badrinath, and in this video we will see anti-romantic drugs. Anti-romantic drugs. In the exam, don't write as a romantic, okay? Rheumatic, Rheumatic, rheumatic drugs, okay? And see here, this rheumatism is a disease related to the joints, body joints. See, all the joints of this hero Prabhas, here, all these joints should be pakka, okay? It should be completely free from the rheumatic pain. Rheumatic pain. It should be, all the joints should be completely free from rheumatic arthritis. It should be pakka. It should be, then only you can able to do a romance like a propose. Here, see, you can see how he is doing such a great still here. You can see. Otherwise, he will be fell down. Joints must be pakka. That otherwise, see here, heroine also fell down. Both will fell down. Though, so that's why you maintain your joints pakka. Then only will become a qualification. That is your qualification. That we will see now. This topic, anti-rheumatic drugs. See, all these are the our body skeleton system, and you can see here rheumatoid arthritis heading. Rheumatoid arthritis. All these joints are prone to, see, which I have shown the color, all these joints will be prone to rheumatoid arthritis. Most of the students, they are thinking it is related only to the knees. No, it is related to total body. Wherever joint is there, there is a possibility of the rheumatic arthritis. That point you have to keep in your mind. So all the joints, it must be pakka. See here, all the joints here. This is a very common. Red color is very common. The joints which I have shown, and yellow color is a common, and less dark yellow color is uncommon. But however, all the joints are prone to get a rheumatoid arthritis, right? And why this disease will come? Here, no villain will be from outside. Our body own immune system is the biggest problem for us. See, our immune system will do some overaction sometimes. That is the main problem. So, overaction of our immune system is the main villain in this film, in this system, or in this disease. Overaction. And see here, and it is a autoimmune disease which comes automatically. Okay, it was there. You are, even though your immune system is very strong, and sometimes it does some overaction due to that problem only. See, immune system is good for our body, that we know very well. So whenever there was a entry of antigen from outside into the body, our body will develop the antibodies. But here in this disease, what happened? Our immune system will feel that our body own cells like antigen. That's why body start producing the antibodies against our own body cells. That is the main problem. That is the overaction, right? Okay, now you got a clear-cut difference. Antigens usually coming from outside. But here in this disease, our body immune system will feels our own body cells as an antigen. Okay, that is the main problem. Yeah. See here, and here I am comparing the rheumatoid arthritis with the osteoarthritis. Both are different. Okay, so that's why I'm comparing both as a side by side, so that you can understand well. Okay, don't get confusion between osteoarthritis and rheumatoid arthritis. See, this is the healthy joint. You can see the normal bones, and as well as the, here you can see the white layer. This is the synovial membrane. It is a very healthy. See how much healthy is here. Whereas when you come to the osteoarthritis, osteo means bones. Mainly bones will be damaged here. See how the bones are, density of the bones is becomes very less. There is a formation of a holes, formation of a pores in the bones, and there is no synovial membrane. Check here. Okay. And here, when you come the rheumatoid arthritis, bone is eroded like this, bones, as well as the synovial membrane also erased. Both are erased. Synovial membrane as well as the bones. Both will be eroded. Some it is some removal of the synovial membrane cells or bone cells. Both will be removed. And main biggest problem is here you can find the red color. Red color. You can see the red color here. It is not there here. Inflammation, very powerful in inflammation. Inflammation is a factor of five things. Ruber, Kahler, Dollar, that and all I have explained in the non-steroidal anti-inflammatory drugs video that you go and check it. Inflammation is the biggest problem here. One is our own body immune system. Number two, that is the inflammation. These two are the two things which causes the disease. You keep in your mind, right? And if you want to look the direct photo, here you can see the with the naked eye, it looks like this. This area below the knee, just below the knee, you can find the area. And also it comes to the hands. See fingers, swellings are there, inflammation is there. Okay. So chronic synovial inflammation is the main characteristic of this disease. Okay, synovial membrane inflammation. It's very severe condition. See here, this is the and very too late. Too late. Okay, he already suffered a lot, and in the final stage, he went to a doctor. Okay, it is too late. Yeah, and this is very costly disease. Actually, gold we are using to wear as a jewelries, etc. and all. In this disease, we are using for the treatment of rheumatoid arthritis. That's why I'm saying it was a costly disease, so that you can enter into your brain as a gold. Gold we are taking internally. We are taking to avoid this disease. It is a costly. That's why be aware of it. Okay. Yeah, this is the your syllabus pharmacology as per your university, attacoids and related drugs. In this, I have completed all these things in my videos. It was there in the playlist. Okay, and last you can see anti-rheumatic drugs. This point we are going to be covered. Okay, that's why I highlighted with the red ink. Yeah, classification as per the your KD Tripathi book, Medical Pharmacology. Here, anti-rheumatoid arthritis drugs, okay, classified mainly into three categories: A, B, C. A, B, C. In these three, first basic one point I will say, modification is the key point here. Modification, that is the key point. Here I will show you. Modifying. And here also you can see modifiers. This is the main key point. See, since there was a disease which is from our own body, here two options will be there for a doctor. Number one is he has to modify the disease. That's why A is a here. Disease modifying anti-rheumatic drugs. These drugs, no, these class A drugs, it modify the disease. See, I first one you see immunosuppressants. I told no, immune system will do overaction. So that's why the disease is in the immune system only. Okay, so we have to suppress the immune system here. Okay, that's why we are modifying the disease, right? You got my point? See, first all the classification of A, modifying the disease. Second one is it modifies the biological response, our body's response to the disease. Our body's biological response to the disease. That's why this is called a biological response modifiers. That is a two things are there. TNF, very important. Alpha. TNF alpha. IL. Okay. And third one is adjuvant drugs. Adjuvant means, keep in your mind, doctor has here only two options. Either he has to give a or he has to give a B. You got my point? Adjuvants are the third type, C category type. Adjuvants always you should not give a alone as a drug. Either you have to combine with A or you have to combine with the B. Adjuvant, just like a plus. Okay, supplementary like that. Okay, don't give the C as a alone. Sometimes it is giving, but you should not give adjuvants. Okay, first we will see what is adjuvants. Adjuvants are the corticosteroids. Prednisolone is the main important drug. It comes under the steroidal anti-inflammatory drugs. There is a two types of drugs are there. Steroidal anti-inflammatory drugs, non-steroidal anti-inflammatory drugs. You compare both. It comes in the steroidal anti-inflammatory drug. Okay, prednisolone. It is also called as a prednisolone. Okay, first that we will see how to remember this prednisolone. Yeah, here you can see the image. This is one of the type of system you are predicting the future. How to predict future? Here there is a color, white color ball will be there, and he is alone, prednisolone, prediction, PRED. Here you can see the PRED, prediction, alone, OLONE, like that easily you can remember. Prednisolone, prediction, alone. Okay, but since name is alone will come, but you have to give in a combination either along with A or along with B. So now C is over. Okay, it is very good anti-inflammatory drug. It suppresses the immune system also, steroid drugs. I have already told in my NS8 video. First we will see A, disease modifying. We are modifying the disease, keep in your mind. Anti rheumatic drugs. It is in short form, it is called as a DMARDs, DMARD. Here you can say DMARD, almost same except last letter. DMARD, DMARD. D, whenever you see the DMARD, keep in your mind it is an anti rheumatic drugs, disease modifying. You keep in your mind, right? And first one, immunosuppressant. Here total 6 are there. Immunosuppressants first. 3 drugs are there. Methotrexate, very important one. Azathioprine, cyclosporine. That suppresses the immune system. Sulfasalazine, number 2. 3, chloroquine or hydroxychloroquine. Leflunomide. Fifth is gold. I already told you gold. Sodium. Gold is important. Remaining 2 are just leave it. 6, D-penicillamine. So how to remember these drugs? I have shown here. Total 6 is here. No, 1, 2, 3, 4, 5, 6. Here also I have shown 1, 2, 3, 4, 5, 6. First one is immunosuppressants. 3 drugs are methotrexate, azathioprine, cyclosporine. C, cyclosporine, A, azathioprine. MCI means it is a Telugu film, middle class abbai. So it is a story related to middle class family. So methotrexate, middle class people, they are using a cycle. Cyclosporine, आ जाते हैं, आ जाते हैं. Middle class people, cycle पे आ जाता है, azathioprine. You can see, आ जाते हैं, azathioprine, cyclosporine, methotrexate, MCA, MCA. Okay, and next is sulfasalazine. This is a salad, salazine. Okay, it is a salad, veg salad, vegetable salad. This is, and chloroquine, hydroxychloroquine, using as an anti-malarial drug. Here you can see the mosquito, which causes the malaria. Next is leflunomide, Lee. See, first one, see Lee. Next is flu. So he is a Dr. Lee from China. He is suffering with the flu. Lee flunomide. half of the name at least you should be in your brain, otherwise it is not possible to remember for a time. Okay, up to the examination you have to remember. Next is gold. You can see the gold biscuit here, and penicillamine, pencil. Okay, so in DMARD you purchased a pencil. So all these comes under the DMARD. Total 6 are there. Okay, that you have to keep in your mind. DMARDs. Now we will see the B, biological response modifiers. Here, two devils are there. Two devils. One devil name is TNF alpha. Another devil name, this devil name is called as a IL-1. These two devils, they have a capacity. One devil will change to another devil is also changed to first devil, like that. First devil to second devil to first devil. Like these are the biggest two devils which are there in your knee. This is the structure of knee. See what happened, this IL-1 interleukins, these two, what it does, no, it releases the chondrocytes. These chondrocytes, very important in the examination in pathophysiology also. Chondrocytes will damage the synovial membrane. You can see the layer here, no? Synovial membrane. The synovial membrane will be damaged by the chondrocytes, which are released by the IL-1. And this also releases the osteoclasts. Osteoclasts. These osteoclasts damage the bone. Two things. One is damages the synovial membrane. Another one damages the bone. Both are the problems in the rheumatic joints pain. Both are problems. Okay. Now what you have to do is either I have to kill the both TNF alpha, IL-1. I have to kill these devils. Both I have to kill. Otherwise, one devil will, if I will kill one devil, another devil will change to second devil. That is a problem, no? That's why you have to kill the both. How to kill this? Okay. Yeah. Here you can see the how to kill. Second classification we will see now. Biological response modifier, in short form it is called a BRM. Just like a first one DMARD, second one BRM. TNF alpha, this is the devil name, and another devil name IL-1. So now what we will do, first this IL-1 will be killed by this fellow. Who is this fellow? Kinra. You can Google it. Kinra is a very popular kid. Famous in Tic Tac. He is doing always Tic Tac, Tic Tac, Tic Tac, and he become a star in the Tic Tac star. Okay, that's why Kindra is a name. So whenever I saw the name Kindra, just this fellow, I got the name of this fellow, Kindra. This fellow kills the IL-1. Whereas TNF alpha inhibitors, etanercept, concept, eta is a soap, concept. Last word you have to tell, etanercept. Okay. And infliximab. Netflix. It is one of the OTT platform for the various movies. Inflixi. So this I kept this side because both will kill this TNF alpha. Whereas our Kindra, little hero, okay, he will kill the IL-1. Yeah, like that we can remember. Yeah, here this is the mechanism. Overaction of our immune system. Higher level immune regulation and immune senses. APC here I wrote antigen protesting cell. This stimulates the T cells, our body immune system T cells, and B cells will be stimulated by this APC, antigen protesting cell. Okay. So these two C reaction, and these three will finally start producing the IL. See here, IL, TNF alpha. Villains I have said no. TNF alpha, IL-1, IL-6. See here, how many IL are? All these will be killed by. Now you can see here SSZ will avoid this. SSZ, sulfasalazine. Gold. Gold is also used in the treatment. This also avoids this one and as well as the T cells. And now you see MTX. It is nothing but a methotrexate and leflunomide. It comes in the DMARD. Okay. LEF, leflunomide. It avoids the T cells, B cells. Okay. This you can draw in your examination, right? Yeah. Among all, only one drug is important. We will see the details of first drug. First choice, number one choice, generally we will give preference to America. That's why I kept the first choice always will be America. Here, first drug is the methotrexate. 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 Here you can see. Methotrexate injection. That is a BP. British Pharmacopoeia. Tablets is also available. Injection is also available. Why this is a first choice means it is having a two super characters, very good, excellent characters. One is it prominent immunosuppressant property one side. That is the biggest problem I have already told you. Immunosuppressant. Okay. One it modifies the disease. Number two, prominent anti-inflammatory action. Chronic inflammation is the biggest problem in this disease, I have already told. So one side, it is a double check. One side, it suppresses the immune system, and another side, it decreases the inflammation. So that automatically that all the doctors, as MBBS students, as pharmacy students, as nursing students, you should first of all, you have to give a first choice. Okay, methotrexate. This methotrexate inhibits the dihydrofolate reductase. This is as per your KD Tripathi book, cytokinin production. And I have already told mechanism of action in the previous slide. Chemotaxis, cell-mediated immune reaction. This I have shown. Cell-mediated immune reaction in my previous slide I have explained. And this is the first choice of DMARDs, that is among all the DMARDs. This is the first choice. Number of times it was appeared in the old question papers. Standard treatment. It is a standard treatment. Includes the juvenile rheumatoid arthritis. Oral low dose 7.5 to 15 mg. Relief is within 4 to 6 weeks. You will not get immediate relief. Okay. 1 month to 1.5 months. Preferred for initial treatment. Bioavailability is variable and it varies with the food. And contraindications we will see. Pregnancy, breastfeeding, that we will see. Contraindications. Pregnancy, see here pregnancy, and also breastfeeding. Both I kept in same diagram. And also leukopenia. So don't give this contraindication. That's why I kept a cross mark here. Contraindications. Leukopenia. See here in this diagram, this is a normal and this is a leukopenia. Leukocytes will be decreased. 3 here. So since this drug will suppresses the immune system, okay, if the patient is this is already suffered with leukopenia, don't give this drug because again there is a suppression of immune system. Okay, that's why you should not give a totally no leukopenia will come. Leukopenia means less leukocytes. Leukopenia. Okay, in such a case, don't give because it is very dangerous. And also peptic ulcers. See here, you can see the peptic ulcer due to the excess acidity secretion and the release of that. And the liver diseases. These are the different liver diseases like a healthy liver, fatty liver, liver fibrosis, liver cirrhosis. These are the different stages. Okay, very simple. Okay, so I will stop here this video. So we have completed anti-rheumatoid. Methotrexate is the first drug, first choice you have to keep in your mind. Okay, and then you be fit all your joints. Okay, and you can able to do romance like a Prabhas with Pooja Hegde, right? Yeah, I am end here, and in my playlist I have kept all my videos that